what's the difference between mental illness and just being a run-of-the-mill asshole? Like clinically. Where does someone stop being an asshole and cross over to be TikTok?
Yeah.
All right, ta-ta there, retard.
It's kind of a good question. It's overly simplistic, obviously. But the point is, serious mental illness are usually what we call axis 1 illnesses. So psychotic episodes, depressive episodes, anxiety disorders. So thought disorders, anxiety disorders, mood disorders, these major categories, bipolar disorder, as I said, schizophrenia, these sorts of things that cause people to have essentially disabling symptomatology. That's the inability to function is one of the main symptoms of serious mental illness. And, you know, if you're hearing voices and if you're thinking of suicide, these are all the symptoms that people manifest with them. Now, being an asshole can also be a sign of mental health issues, usually in the zone of sometimes substance use, right? People who are doing drugs do terrible, terrible things, not because they're a terrible person, because the disease has them doing terrible things, but even more so, personality disorders. So personality disorders are the phenomenon that cause people to have trouble in relationships. Many of the disorders that are common these days include unregulated hostility and anger. That's being an asshole. And also sort of part of the common kinds of personality disorders people have today, people aren't able to maintain empathy and they exploit other people. And so it feels bad to be around them. So when you're talking about an asshole, you're talking about somebody who just makes you feel bad to be around. And those tend to be either addicts who are in their disease and can't help themselves, or people with personality disorders. And those don't really change. They are technically mental illness, and people can sort of learn their therapeutic techniques to help mitigate some of the assholishness, quite literally, but they don't really go away, those problems. You're nodding vigorously. What are you thinking?
No. Just, that all.
Like borderline personality disorder doesn't go away, but you can really reduce some of the borderline stuff with dialectical behavioral therapy. Narcissistic personality disorder can be a really pain in the ass to be around, but doesn't really go away. But you can sort of do interpersonal therapies where you raise awareness of, you know, the impact people are having on other people. So that's that. That's an interesting question, actually.
Right. It's like, there's the difference between like, oh, this person's unpleasant to be around, and like, oh, this person needs help.
Yes. And the people that are assholes, it's usually the people around them bringing them in. Like, change him, he's driving us crazy. And with the people with serious mental illness, it's the patient themselves, the family because they can't function, or law enforcement who bring them in because they're doing crazy shit. All right. So,
Drew, I have a question about sorry to go back, but the girl who slapped her boyfriend.
Yeah.
I feel like we all have those kind of weird impulses, you know, whether it's like, I wouldn't say slapping someone, but like maybe like you're in a car and you want to kind of open the door and jump out. I feel like people have those weird random thoughts. Mm-hmm. What is the mechanism that like stops people from acting on those impulses? And is that kind of similar to what she kind of lacks in that situation?
I'm not sure I can answer that in a meaningful way, except to say that having weird, intrusive thoughts of all kinds, unpleasant thoughts, that's on the normal spectrum, right? As you've said, people can have these thoughts like, what if I just pull my car into the center divider and stuff? What makes people do that are things that either mood disturbances, right? Like, I really want to hurt myself. The pain is intolerable, the mood problem. What makes people do intrusive, compulsive kinds of things that they find they have to do, or they fear that something bad's going to happen to them. That's in the obsessive compulsive disorder sort of zone, right? So there's the sort of drive to do these things. Then there's what contains them. You know, and if you don't have the sort of disorders that really make them likely to happen or likely to go from thought to behavior, then what contains them, that's your frontal lobes, right? We have these large systems in front of us that both cause us to sort of acknowledge dominant impulses, but be able to suppress them and maybe choose a subdominant impulse. And our frontal lobes have the capacity to think things through. In other words, we then think, well, what would happen if I opened my car door and jumped out? That would hurt. I would be disabled. I could die. I didn't really want to do that. It's just a weird thought I had all of a sudden. And so there's plenty of mechanisms in place to help us. Even just the idea of focusing, right? You have to have the focus on not doing that. There's many different mechanisms at work in containing our impulses, but they are pretty easily contained in normal situations.
It's all frontal lobe
stuff. Frontal lobe stuff.
Isn't that where, with like lobotomies, they would kind of go after the frontal lobe?
Right. So, when I arrived at the psychiatric hospital I worked at for 30 years in 1985, there were lots of psychosurgery patients there. And because I was the new internist in town, I acquired lots of them. They were catastrophes. They were just horribly disabled. And if you ever heard the case of Filius Gage, do you know who that is?
Is that the guy that had the nail in his head?
He had a railroad tamponing spike that they used to tamp an explosive, blow through his eye actually, and take out his frontal lobe. And when he had the injury, he was sort of blunted and out of it, but he kind of recovered and seemed okay. But with time, he developed into what really is sort of a sociopath. He couldn't contain any impulses. He didn't appreciate that other people had feelings. He was hypersexual, just whatever.
Yeah,
just
he became an asshole, right?
He became an asshole.
His personality.
Became an asshole, right? And that's that frontal lobe thing. Now, with lobotomies, your frontal lobe is still there. It's just not properly connected to the rest of the brain. So it's not quite as overt as somebody's frontal lobe is blown out. His frontal lobe is blown out is Gary Busey in his motorcycle accident. And so you'll see him do kind of impulsive things that seem unpleasant around other people, but he doesn't perceive what he's doing sometimes.